Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about why some kids have that extra tiny hole next to their ears. The preauricular pits. What, where, when, and why the extra tiny hole next to the ear exists and how to treat it. One thing that alarms all mothers is when something unusual appears to their child's physical attributes. This extra tiny hole next to the ear, for instance, can be seen only in a few individuals who were naturally born with it. What is it called? The extra tiny hole next to your child's ear is called preauricular pits and has many other terms such as ear pits, preauricular cysts, preauricular fissures, and preauricular sinuses. It is a condition that is caused by a congenital defect. It most likely occurs during the formation of the auricle, the outer part of the ear, during the first 2 months of gestation. The hole formed is an opening of connected sinus tracts that can either be short or branching out in different directions, zigzagging throughout the ear tissue. Experts think the pits develop when 2 parts of the auricle, known as the hillocks of his, don't properly join together. No one's sure why the hillocks of his don't always join together, but it may be related to a genetic mutation. Though it's an inborn abnormality, experts have proved that it is something not to worry about as it is often a benign condition, although it does have chances to get infected. That being said, it may rarely be associated with certain genetic syndromes like branchioautorenal (BOR) syndrome, Beckwith-Wiedemann syndrome, or mandibulofacial dysostosis. Taking propylthiouracil medication during early pregnancy might also cause preauricular pits in your baby. This medication is used to treat hyperthyroidism, or an overactive thyroid. Symptoms of preauricular pits. Preauricular pits look like a pinhole or dimple in front of your ear. Other people might mistake it for a piercing. Most people who have a preauricular pit don't have any symptoms or hearing problems. Sometimes you can get an infection when the opening seals bacteria inside. Its symptoms include redness, swelling, pain, fluid discharge, fever. How is it diagnosed? When you, or your pediatrician, notices a preauricular pit, a specialist called an otolaryngologist, or an ear, nose, and throat (ENT) doctor is the most recommended doctor to go to for your baby to make sure the pit is not a marker of something more serious. Your ENT doctor will first want to rule out genetic syndromes sometimes associated with preauricular pits. The doctor will have a close look at your child's ear, head, and neck, as these pits can as well be caused by other syndromes which often result in other ear malformations that lead to hearing loss. Your doctor will also check if the preauricular pit is present in one or both ears of your child. If both ears are affected, it's more likely that the cause is a family history of congenital malformation. A computerized tomography, CT, scan, or a magnetic resonance imaging, MRI, scan with contrast is sometimes ordered by your doctor to be performed to better examine the pit. This also helps the doctor identify underlying complications like an infection or cyst. Some other tests that your doctor may perform also include an audiogram or a hearing test if some other abnormalities are found other than that extra tiny hole next to the ear of your child. The doctor may also order a kidney ultrasound if the ear pits are suspected to be of the branchioautorenal syndromes. Ultimately, if a genetic syndrome is suspected, you will be referred to other specialists who can help you manage organ-specific problems for your child. What to watch out for? Preauricular sinus is lined with skin cells and can get blocked and infected at any time. It may be infected that can lead to the formation of abscess and cellulitis. Look out for the signs of an infected preauricular pit, which includes pain, fever, redness, and/or a foul-smelling yellowish discharge that requires treatment from a physician. How to treat it? Antibiotics. Your doctor will give you antibiotics to treat an infection if your preauricular pit has a smelly discharge or other symptoms of infection. Make sure to take the pills until your prescription is finished. Home treatment. There are things you can do at home to manage a preauricular pit infection along with taking your antibiotics. Examples of home treatment include pain relievers, warm compresses on your ear, keeping the area clean of any discharge, avoid touching it, needle aspiration. If you get an abscess, your doctor might insert a needle into it to collect fluid. They will test the fluid to find the type of bacteria. This will help them prescribe the right kind of antibiotic. Drainage. Your doctor might use a sterile needle to drain the fluid and pus if your abscess doesn't get better with antibiotic surgery. Some people get cysts and lots of infections. Your doctor might recommend surgery to take out the entire sinus tract. This procedure is done under general anesthetic but can often be done in an outpatient clinic. You will have to wait until the infection clears up before you can have surgery. Fun here says about preauricular pits. Did you know that some studies claim that having this extra tiny hole next to the ear is a sign that the person born with it is an extraordinary being? Preauricular sinuses are more common in people with African and Asian heritage, with up to 10% of the population of Asia and parts of Africa having them. In cultures where they're more prevalent, there are some superstitions about them, like associating the condition to attracting wealth or a higher IQ. Need I say more? However, the outlook for you or your baby is good. Most people with this condition don't have problems. Infections can be easily treated with antibiotics. Make sure to talk to your doctor for treatment if your ear is bothering you or you have signs of an infection. Comment below. The fun here says you have heard in your region or culture about preauricular pits. Preauricular sinus is a fairly common occurrence. It is present in about 5 to 10 out of every 1,000 births. No one likes to think of their baby as having a congenital malformation, but it's important to remember that ear defects are common. While it's best to have your child checked out by an ear specialist to be sure, the good news about preauricular pits is that in most instances, they pose no risk to your child. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.